This video is part of the FID series on the OIA Protocol for peer review of faculty and offers tips for how to document your observations. The first tip is to take good field notes. You want to do these as close in time as possible to the event and be specific. Whether you use pen and pencil, a laptop, or a mobile device depends upon the setting. In a clinical setting, for example, it's probably best to use a mobile device. Good practice is to take notes in between patient encounters to reduce distractions to patient care. The goal is not to disrupt the experience we are observing, so in a clinical setting, we wait until after patient encounters. In a classroom setting, it's generally not disruptive to use a laptop while we're observing. Tip number 2, look to the observation guide. It will tell you what to look for. For example, if you're looking at learning climate, you could document receptivity to questions or allowing students enough time to answer questions. In clinical settings, the observation guide will likely suggest that you look for whether the instructor offered constructive feedback or established clear expectations or created opportunities to practice clinical skills. Tip number 3, include specific examples. For example, regarding wait time, note how long on average the instructor waits before jumping back in the discussion. On receptivity to questions, note whether the instructor encourages questions and how they react when interrupted with questions. You could document specific ways in which instructors prepare students for patient encounters. Or you might document how the instructor utilizes patient presentations as an opportunity for teaching. If you're looking at documenting specific examples of inquiry teaching in clinical settings, you could note the frequency and type of questions asked. For example, using basic recall questions and then graduating to more complex how, why, or what if questions. Then you would want to describe how they use these questions during patient presentations. For example, you could specify that they ask students to describe diagnostic criteria and how they might use these to rule in or out specific conditions. You can document how they give constructive feedback, for example, guiding students in how to interpret imaging. Tip number 4, document your impressions ASAP. This is your global impression of the teaching you observed. Was it exemplary of how people should teach in that kind of setting? What did they do particularly well, or what might need improvement?
Up next, tips for writing the evaluation letter.